time to write goals. You have all these numbers and calculations. Now you're telling the reader what it means, why it matters. Here's how to get into a good headspace to create goals. Think about how their scores can translate into real-life tasks. Zoom out. And remember that the job, speech therapy in general, is to help with safety, independence, and quality of life. How could those numbers you came up with impact safety, independence, and quality of life? It's going to be based on your professional judgment. So they scored 40% on single word naming. What does that mean? It probably means it's hard for them to ask for what they need. So a goal could be something like, patient will produce single words related to daily life at 70% accuracy given cues. They received a severe score on the MoCA, but what does that mean though? Think about what you could do about it as a speech-language pathologist. Take the other information you gathered to help you interpret what that means. Maybe you heard from OT and PT that the patient seems really impulsive and is at a high risk for falls. That might mean they would benefit from 24/7 supervision for safety. You could write something like, patient will complete simple problem-solving tasks related to safety at 80% accuracy given cues. You see that your patient is 60% intelligible at the sentence level and 40% intelligible at the paragraph level. What do you do with that? What does that mean? First of all, remember that this is not just about intelligibility, but about the patient's quality of life. Zoom out. In this moment, does the patient have a hard time asking for basic things like, please turn off the light, or my back really hurts? If so, you may conclude that the patient has reduced ability to communicate basic wants and needs, and recommend intelligibility treatment tasks, or use clear speech strategies or simple AAC. When you zoom out and remember the purpose of the job, which is safety, independence, quality of life, then it's much easier to generate goals. Check in with yourself as you're typing your report. If you realize you've been zoomed in too long or you're getting tunnel vision, zoom out, see the whole patient, and make your best professional guesstimate on how your patient's current level of functioning may affect their safety, independence, or quality of life. On adultspeechtherapy.co, we have a list of over 150 short-term goals to help you get into the right headspace. It's a free article, so check it out. If you want a more step-by-step guide for this process, including how to score informal assessments or an oral mechanism examination, check out the Roadmap course. If you go to adultspeechtherapy.co, you'll see a link on the right side of the page. That's it for this week. I'm Chung Brewer. I hope this video can add value to your practice. Thanks so much, and I'll see you next time.